Look at the, Mike's point is that many of these countries are smaller, they have smaller population base, and they are homogeneous countries, right? Where you don't have large groups of people coming from all over the world all in one place at the same time. So yeah, you're onto something. I saw other hands. Mateen, did you have your hand up?
Yeah, in Turkey, it's totally the same as you said. Government collects taxes, and then nobody worries about the health issues.
So in Turkey, it's universal health care, socialized medicine in Turkey.
Yeah.
So what might be lost when you have universal health care? What's different?
Actually, you don't lose anything.
How about if you're a doctor?
No.
But do you think doctors can get as rich in Turkey as they can in the United States?
Oh, I don't think so.
I don't think so,
Yeah.
right? And I'm not picking on doctors, and I'm not, look, I will tell you this, I'm not picking sides on this question. That's not the point. The point is for you to understand the debate, put it within the context of what this book is talking about. Of course there's challenges to universal health care.
Mm-hmm.
Otherwise we'd all be doing it. Doctors have to be willing to pay the price by often not commanding the types of salaries that they may in the United States, particularly specialists, right?
Mm-hmm.
Specialists in the United States, a brain surgeon, can command very, very, very high salaries. Why? Because that's dictated by the marketplace, right? It's dictated by the marketplace. If the marketplace says we have a shortage of doctors willing to do brain surgeries, we have a pool of people willing to pay for brain surgery, they can command, right? They can command high salaries. On the other hand, family practitioners make less than brain surgeons because we got a whole lot of family practitioners in the United States, and we have fewer brain surgeons.
And it's a lot easier to get via GEP doctor than a brain.
I don't, Mike says it's easier. I would say that it's, a better way to think about it is that it takes less training, right? It takes less years of training, less years of schooling, and it probably costs you less money to pay to become a general practitioner than to become a brain surgeon. So again, all driven by market forces. So what I would suggest is that in Turkey, it probably takes a long time to get brain surgery. You probably have to wait a long time.
Yeah.
Because you probably don't have a lot of people practicing brain surgery.
Actually, health system is
getting better, right? That's what I hear.
Yeah,
That's what I hear.
there are many good doctors, and especially in private hospitals, you pay more, but you can go there if you are a governmental officer.
Right.
But you pay more.
Okay. So here's what I'm saying. Yeah, you're right. All right. So the way for you to think about it is as follows. The challenge of this is to say, if the marketplace dictates, right? If the marketplace dictates cost, profit, well, we're going to pay brain surgeons more because it's in demand and less people are doing it. So they can demand high salaries. So we've put ourselves in a position where, because it is market driven, people can command the types of salaries that we are willing to pay for. As long as you don't see Nike dropping their prices for the hell of it. If they feel like selling a fucking pair of shoes for $200, $225, they're going to do it as long as what? As long as we're paid for it. So as long as we're willing to pay this much for healthcare, doctors, medical practitioners get used to commanding these salaries. On the other hand, the opposing argument is, why don't we do that with school teachers, right? We don't do that with school teachers. School teachers, we would say, are important, right? Public schools, teaching is important. You gotta have teachers, and I'm not talking about university professors. They're a bunch of spoiled brats, right? I'm talking about elementary, middle school, high school teachers. They don't command large salaries, right? Because in Scandinavian countries, that's what they say. They end up saying, why do you have to pay doctors so much? Nothing tells you that you have to pay doctors so much. Teachers spend many years in school. They spend many years getting an education. Because frankly, according to the argument, you enter teaching because you're passionate about it, not because you want to get rich. We should culturally think about medicine the same way, right? That you're serving others. We just have not put ourselves in that frame of mind because healthcare has been provided through a private-based model. Mike?
Well, and there's the other issue of kind of a vicious cycle where to become a doctor, unless you're rich to start with, you rack up so many bills
For
going
sure.
to medical school that you have to make a lot of money to pay those bills back.
For sure.
So it's kind of like,
I'm with you, right? So that's the counter argument. The counter argument that Mike just made is it costs lots of money for somebody to become a brain surgeon. They're going to get out of, I don't know, is there such a thing as brain surgery school? Whatever, right? They're going to get out of medical school as a specialist and literally owe hundreds of thousands of dollars in debt. Therefore, to continue having people do that, we have to pay them a lot of money once they get a job, right? Or there's no incentive for people to do it.
yeah, why do it? So
The whole premise here is to understand that in the United States, for better or for worse, we have a market-based system, a semi-government-based system with Medicaid and Medicare that, according to the argument, is failing millions of Americans. Because we have 48 million uninsured Americans, right? At the time of the writing of this book. So what the Affordable Care Act tries to do is to devise a strategy that leads us towards a universal healthcare system, right? It essentially gives incentives for people to join the government system and may often penalize people for staying in private systems, right? It'll penalize people for staying in a private system. So it's kind of trying to force. I can't think of a better word. And I'm not telling you I'm for or against the Affordable Care Act. Doesn't matter. It's trying to push people out of a market-based model and get people into a government-sponsored model. Because frankly, it's going to take people paying into it. It's going to take people taking their money away from this. I'm not going to pay into this anymore. I'm going to pay into the Affordable Care Act. And what you really want is a whole bunch of healthy people with jobs, right? With money, paying into this.
Give and not take.
I didn't say that, right? I mean,
Realistically, that's what you need to make it work.
I don't know. I mean, Mike says give but not take, right? In a sense, I suppose financially that's what you want. But you know what, my friends? That's what insurance is, right? Geico only exists because more people are putting in than are taking out. If we all wreck our cars tomorrow, Geico's going to go out of business. Geico goes out of business because we all pay in, but few of us wreck our cars. So when somebody does, it's not a problem for them because the vast majority of us don't wreck our cars. So really the Affordable Care Act wants the vast majority of us paying into it, but few of us getting sick, okay? How this all ties into healthcare is that often in most Scandinavian countries and Canada, places where you have universal socialized medicine, mental health care is also part of the healthcare system, right? In the United States, once again, seeing a therapist, seeing a counselor, medicine that is there to help treat mental health conditions is part of a privatized system. So one of the things that we're learning is this. As we've looked through this whole book, these pathways that we've often talked about, physical health and mental health are linked. If you look at your book, there's a thing on, I don't know what page, figure 10-1, barriers to accessing mental health services. And I'd like you to have a sense of this because it's, again, trying to put together these pathways that we've talked about of how macro level and micro level forces work together as an impediment to healthcare. So if people don't have access to healthcare, what might be one of the primary mechanisms which impedes people from having access to healthcare? What's the big one? What's the big thing that keeps us from?
Unemployment.
Yeah, we don't have jobs, right? Lack of unemployment. We talked about education, a lack of education. Substandard housing, right? There's less going into government systems of healthcare provision, so as Reed said, so they're often inadequate. You bring in something like accessing them. So what if we do, right? What if we do suddenly say we're going to make healthcare by having little clinics available to low-income residents? Where do you think we tend to put those clinics? Where might we tend to put those clinics in the first place? Are we going to put them right in the middle of the hood? Sometimes we may, but oftentimes we don't, right? And what if you lack one of the structural impediments this book has talked about is simple. It's transportation. We are finding now that sometimes even when you do have health care available to low-income residents, they can't get to the health care, right? They can't get to it because there's so few places for them to go that they require the transportation to get them to that health care. So if you lack regular checkups, regular medical physical care, that may often translate into mental health issues that people experience. So one of the fundamental questions then become, what is the potential for a society like the United States to mitigate the effects of mental health damage later in life? Well, the answer, according to the authors of your book, is to put ourselves in a system whereby healthcare access starts very early in life. Remember the two big themes of this book: the unequal society and the unwell society. So a central point of this chapter is to say, when healthcare is unequally distributed, when healthcare access is unequally distributed, we should then expect unequal outcomes in terms of the burden of disease, the burden of illness. So that mental health, as we've looked at this whole semester, being linked to physical health, if we can't provide physical care, physical medical care early in people's lives, we should expect that to translate to negative outcomes later in life. So take a look at that figure 10.1 and have a basic sense of these differences between patient level factors, provider level factors, and systems level factors that are all impacted by our inability to provide a fundamental safety net of healthcare in the United States. Okay, chapter 11. Chapter 11 would be the policy, right? The policy aspect of your book. Here, I think the important thing is for you to take a look at figure 11-1. Figure 11-1. Because I think what this figure does, we'll put up some slides, and as the slide says, emphasizes the role of efforts to address societal determinants of health by implementing effective public health interventions. By effective public health interventions, generally what the authors of your book are talking about is this whole unequal society thing. Effective public health interventions for mental health care, physical health care, involve making it more equal, making it more available to more Americans. So when we talk about 48 million Americans being uninsured, their argument would be make it a greater safety net. There's not a whole lot of discussion of the Affordable Care Act in this book. I'm sure in later editions they're going to spend a lot more time talking about the Affordable Care Act. But let's understand that what we call the Obamacare, the Affordable Care Act, I'm not telling you, look, do we know, when was the Obamacare Act passed into law? How long ago? It's a couple years ago. Is it working? Is it working? Is it going to work? Is it not going to work? What's going to happen?
Can't tell yet.
It's not doing well.
Not doing well?
A lot of the exchanges went up.
Some of the exchanges, which are the sort of the actual repositories of healthcare, right? These exchanges that provide healthcare for Americans, some of them are just going out of business. Now, I think some of the early numbers are showing us more low-income people are becoming insured. I mean, some of the data is starting to come in. There's more people, low-income Americans that previously didn't have healthcare who are now insured. I mean, that's just kind of a reality. But we also know that what's happening to premiums. Yeah, people's premiums are getting jacked up, right? Not everyone's, but if you're a higher income American, your insurance premiums are generally getting jacked up. I know mine are, right? So then this puts the onus back on individuals. The authors of your book are trying to make the case that in a more fair society, right? In a more fair society, those with higher incomes, those with more resources, should be willing to pay higher premiums. Because if they pay higher premiums, it assures more of us as a society. So, if I'm paying more in premiums to insure more low-income Americans.